now we're going to demonstrate a basic arm sling. So we use a basic arm sling generally for injuries of the wrist, forearm and ribs. So for this sling we're going to be using a triangular bandage, as you can see. So we're going to place the bandage with the longest length vertical to the body and the point of the bandage towards the elbow of the injured arm. So we're just going to get our patch to lift our arms slowly, and we're going to place the bandage across the body, like so, with the point of the bandage towards the elbow, to the height of the elbow of the injured arm. So then we'll place our arm back. We're going to take the other arm of the bandage and fold it across the shoulder. So just wrap it around and fasten it with a knot. You want to make sure the knot is not too tight and that it is not on bare skin, so we're not irritating the casualty, so that it's comfortable. Then we're going to take the end and just wrap it around to secure it and tuck it in. We're just going to leave some space so that you can see the fingers so that you can check circulation. Okay, so that is a basic arm. Now we're going to show you a basic elevation arm sling. Okay, so for this sling we're going to use a basic triangular bandage, as you can see. Okay, so the first step we're going to do is take the casualty's injured arm and place the fingers just below the collarbone. Okay, this is to keep them above heart level to reduce swelling and pain. Then we're going to take our triangular bandage and we're going to place the tip towards the elbow of the injured arm. Use the other hand and just get your casualty to tuck it in like so. Then we're going to take the base and carefully lift the casualty's arm. Just place the base below the arm. Take the other end, just wrap it around the other side. We're going to tie the ends then in a firm knot. Try to be careful that you're not tying it on bare skin and that our casualty is wearing something comfortable so the bandage isn't rubbing or irritating the casualty. Okay. Then we're just going to take this end and twist it firmly.
So now we're going to be doing a compression bandage on the hamstrings. This is when you strain your hamstring. So we're going to put the clasp down beside us and we're going to just start just above the knee and we're going to wrap it around 2 to 3 times to keep it in place. We're then going to move up the knee, up the leg, and making sure to keep it tight in order to apply pressure, but not too tight as to cut off circulation or make it uncomfortable for the casualty. So keep wrapping over one layer over the other, and when you come to the end of the bandage, just be sure to tie it tightly to keep it in place using the clasp. So that's a compression bandage on a string. Now we're going to be doing a figure of 8 bandage on a jointed area, and we're going to use the ankle. So we're going to put the clasp down next to us because we'll need it in a minute's time. And we're going to start by wrapping the bandage around the bottom of the foot twice to keep it in place. Then we're going to start by moving up the foot, and we're going to follow the line of up around the ankle, down around the foot. So up around the ankle and down around the foot. Up around the ankle and down around the foot. And today, just for today's demonstration, we're going to enclose the heel area. And it should follow a zigzag motion, and the lines of the bandage should be in a zigzag. Then we're just going to wrap it around the top to keep it in place and put the clasp on it so that it won't come apart. And that is a figure of 8 bandage. Now we're going to turn a triangular bandage into a broad bandage. We're going to start by laying it out flat, then we're going to bring the tip of the bandage down to the base. Flatten it out, and we're going to half this again and flatten it out. Once again, we'll half it and make sure that it's folded the whole way across and just flatten it out. And that's how you turn a triangular bandage into a broad bandage.
Okay, so now we're going to demonstrate an emergency leg sprint for a fracture of the lower leg. Okay, so first of all we want to mobilize the area. So we're going to say the fracture is either in the tibia or the fibula of the left leg. So we're just going to mobilize the area by taking it here and here and just keeping it as still as possible. So once we've mobilized the area, we're just going to check for a pulse. So we're just going to check for a pulse for 10 seconds. Okay, so pulse is there. Okay, now then for the next step, we're going to take something. So we're taking this as an emergency situation. So we're just going to use a jumper here as padding to cushion the area. So we're just going to place it in here between the legs. Okay, all the time keeping the area immobilized. So now we want to place a bandage both at the joints below or above and below the injured area. So for this we're just going to use a broad bandage. So we're going to be placing the bandage in below the hollows so that we're not moving the injured area. So below the knee. We'll take another one and put it just below the ankle. And then we're just going to take one more bandage, slide the 2 feet together just to keep them secure. We're just going to tie the 2 feet like so. Not too tight and not too loose, just so that they're not moving. Now, so when we're tying our broad bandages, we're just going to pull it and we're going to tie the knot at the side of the leg that isn't injured. So once again, not too tight, not too loose. And that is your basic splint for a fracture. Now we're going to demonstrate how to splint a fracture of the lower arm, which would be a break of the ulna or the radius. Okay, so this is just like a splint of the lower leg. So instead of this time splinting against the other leg like we did before, this time we're going to be splinting against the body. So we're going to start once again by placing some padding to cushion the area in between the fractured arm and the body. So we're just going to move the arm out slowly. Place the cushion in between and move it back. So we're going to be using broad bandages again. So once again we just want to place the bandage underneath the hollow so that we're not moving the patient. We're just going to get another one and do the same again. Okay, so we want to have one bandage at the joint above and below the fracture, just as before. Put it down. So one's just at the wrist. We want to keep this one just at the elbow. So we're going to be tying the bandage over the opposite side to the fractured arm. Doing so with moving the arm as little as possible. Okay. So that's just to keep the fractured arm immobilized for as long as possible until help arrives. How to apply a bandage for an open fracture. So with an open fracture, we're going to imagine that there's a protruding object coming from the arm, so like either a bone or a piece of glass. So we want to make sure not to move the object. So first of all, we're going to take 2 unwrapped bandages and we want to place one above and one below the protruding object. So as we need to get someone to hold them in place, it could be a good idea to get your casualty to help you, to keep them distracted and calm. So I'll get Anne-Marie just to help me hold the bandages. So one above and one below. Then we're going to take a slightly bigger bandage and we're going to wrap this around the 2 unwrapped bandages. So first of all, we're just going to wrap it a couple of times up the top just to keep it in place. Then we can start moving upwards, but we want to make sure not to be putting it too much above the protruding object, which would be here. So we're just wrapping it around, trying to keep the 2 unwrapped bandages stable. Because we want to have as little movement as possible. So then we're just going to get some tape to keep the bandage in place. So then we're just going to check circulation by squeezing the nail and seeing if the colour returns in 3 seconds.
So now we're going to do the immobilisation of the spine. Anytime you suspect a spinal injury, it is important not to move the casualty. So I'm going to lie down behind her, putting my hands behind at the back of her head and thumbs just in front of her ears. This way you're able to monitor